Okay, seems like it's already recording. Well, good morning, good afternoon. This is one of our portfolio activities. We're going to be talking about the bone cancer and along with a lot of information that will describe what this is. So let's start with our presentation. Okay, so first of all, let's describe like the main concept. What is bone cancer? This is just some general information to get what this is. Basically, I mean, forward we're gonna explain what the cancer and tumor is, but bone cancer is basically this atypical growing of cells that make up this tumor. In it can be in the bone or it can come from other sources. But this cancer starts when cells begin to grow out of control, it's telling you a typical way, and cells in nearly any part of the body can become cancer and can spread. That's what I was telling you. So this cancer goes like it's bone cancer. There are many different types of bone cancer. So let's first understand what is a tumor, what is a cancer, and let's like differentiate them. Continue, please. Next slide. Okay, first about tumors and cancer. To understand what bone cancer is, I mean, cancer can start in any part of the body, but talking about bone cancer, that's why we have here the information of the bone cells. First, cancer is basically a tumor. A tumor is when there's this abnormal amount of tissue. When cells grow out of control, they make up this tissue that it's just like abnormal. It does nothing. It has no function. It's not an organ. It's nothing. Just like this tissue, this amount of tissue, and it is known as a tumor. Tumor can be malignant or benign. So if it is malignant, this means that it metastasizes and it starts to invade tissue and starts like making this risk, danger to our body, basically. So when the tumor is malignant, when it grows out of control and it starts like for example, like eating and invading other space in the body or many other system or organ, it is known as a cancer. But if it doesn't invade tissue, if it doesn't grow, it's just a tumor in there, it's known as a benign. So only when the tumor is malignant, it's known as cancer. So talking about the bone cancer, we have two different types of malignant tumor. The primary is the one that arises from the bone cells. So we understand that bones are basically the skeletal system, and the skeletal system it's in charge of holding our organs, basically our whole body. So it's like a building. So it makes a lot of sense if we start talking about the bone cells, for example, the osteoblasts. These are the cells that, like the workers, they build, and they are related to structural cells. As I was telling you, they build, they're like workers, so they make up this the bones, and the whole skeletal system makes up this whole thing that holds our body. And we also have the osteoclasts. These are the cells that degrade bones to initiate a normal bone remodeling. So, like buildings, they need this kind of assistance or help in a couple of like sometimes. So when there's, for example, an earthquake, you need to take care of everything so the whole building won't fall or something. So basically, that's how it works in our body. Cells have these different types of functions that all together get along and make the whole system work. So what happens is that this cancer can arise from the bone cells, or it can come from it spreads to the bones from other sources, like for example lungs, thyroid, kidneys. So there's basically this is just a little bit of information for you to understand what about tumors and cancer. And we're now going to start talking about what, like deeply into bone cancer, to know the risk, the symptoms, and everything. So we can continue with the next slide.
Well, next to it we have the symptoms. Some symptoms that can appear are, first one, the numbness and tingling or even weakness of the bone. The second one, the persistent bone pain. The third one, swelling and inflammation over a bone. Also, it can appear a noticeable lump over a bone and a weak bone that fractures more easily than normal. Also, it can appear the fatigue and finally the unintended weight loss.
Okay, I will talk about the prevention, but first of all, it's important to give a general context of the risk factors, which will further be explained more specifically. But well, the risk of bone cancer is higher for those between the ages of 10 and 30 years old, especially during the teenage growth spurt. This suggests that there may be a link between rapid bone growth and tumor formation. The risk of many adult cancers can be reduced with certain lifestyle changes, such as staying at a healthy weight or quitting smoking, but this can only reduce it because currently there is no exact way to prevent bone cancer. Early detection is the only way and the best hope for successfully treating the disease. So, if someone has any of these known risk factors, the correct way to prevent it is to visit the doctor regularly.
Now let's move on with the statistics. Um, okay, so first of all, the ACS estimates that in this year, in 2021, about 3,610 new cases will be diagnosis of bone cancer, obviously, and 2,060 deaths are expected. The cases of primary bone represent less than 0.2% of all the cancer cases. Now, in adults, it's more than 40% of primary bone cancers are chondrosarcomas, followed by the osteosarcomas, the chordomas, Ewing tumors, and fibrosarcomas. The highest level, the highest percentage is the osteosarcomas with 28%. And in children and teenagers, it's more common the osteosarcoma with 56% and the Ewing tumors with 34% more common than the chondrosarcoma. The INEGI from Mexico reveals that the bone cancer demonstrate a prevalence of 0.33% of the population from 0 to 70 years of bone cancer. Meanwhile, with the adults, it's not cataloged within the top 20 that affects the Mexicans.
So we're going to talk about the factors that may induce cancer. What is a risk factor? A risk factor is anything that increases a person's chance of developing cancer. Most often, bone sarcomas are not related to any particular risk factor. Also, risk factors can often influence the development of cancer. Most do not directly cause cancer. Some people with several risk factors never develop cancer, while others with no unknown risk factors do. Most cancers are not related to any known risk factor. The following factors may raise a person's risk of developing bone sarcoma. So it is very important to know the risk factors and know if you have some of them, so you can talk about them with your doctor, and he may help you make more informed lifestyles and care choices. So the genetics take a big part in the risk factors of bone cancer. So if your family members direct blood relations with them, if you share those relations with them, and if they have cancer, they might pass the genes that can be more predetermined to have cancer to you. So if you have a family member that has cancer, you may be in your best interest to talk about that with your doctor, so he could be more informed and he could be telling you to do several lifestyle changes in order to prevent or lower this risk. So another factor could be previous radiation therapy. This means if you already have another type of cancer and you treated that with radiation therapy, you may be able to develop bone cancer. So in many cancer types, the best way to treat it is radiation therapy. And this therapy can also induce the cancer in other parts of the body, this being bone sarcomas. So as I said earlier, chemotherapy for another type of cancer can cause this type of cancer. It is very weird and kind of like dark comedy how treating you against another type of cancer can induce you cancer. So this is what happens.
Okay, now we're going to talk about the treatment. The treatment option and recommendations depends normally on several factors. For example, the type, the stage, the grade of cancer, the patient's preference, but overall the health. The first type of treatment we're going to talk about is the surgery, which is a removal of the tumor and some surrounding healthy tissues during an operation. The ones that made this type of treatment are the surgical oncologist and orthopedic oncologist. Now we're going to talk about the therapies with medication. The systemic therapy, it's the use of medication to destroy cancer cells. This type of medication is given through the bloodstreams to reach the cancer cells throughout the body. These are generally prescribed by a medical oncologist who is specialized in this type of treatments. And there are common ways to give this type of treatment too, like intravenous or orally. And there are three types of them: chemotherapy, that which was already mentioned, the targeted therapy, and the immunotherapy, which are going to be two. We're going to talk about them later. So the chemotherapy is the use of drugs to destroy cancer cells, usually by keeping the cancer cells from growing, dividing, and making more cells. This chemotherapy schedule consists of a specific number of cycles given over a set period of time. Now we have the targeted therapy, which is a treatment that targets the cancer-specific genes, proteins, or the tissue's environment that contributes to cancer growth and survival. And this type of treatment blocks the growth and spread of cancer cells and limits the damage to healthy cells. Now we have the immunotherapy, which is also called biologic therapy, and is designed to boost the body's natural defenses to fight the cancer. It uses materials made either by the body or in a laboratory to improve, target, and restore an immune system functions. And last but not less important, we have the radiation therapy. That is the use of high energy X-rays or other particles to destroy cancer cells. And the most common type of radiation treatment is called external beam radiation. And when radiation treatment is given using implants, it is called internal radiation therapy or brachytherapy. Okay, we're gonna leave the link of the video in the presentation so you can see it. And well, this was our topic of genetics. Thank you so much for your attention. And we're gonna leave also the reference so you can see where we get the information. Thank you so much.